Welcome. We are really glad you are here for our What's Next? Practical Steps for Patients and Families After Diagnosis webinar. My name is Ashley Varner, and I'm a cognitive neurology social worker here in the cognitive neurology program at Emory. I'm joined today by my colleague, Alice Cooper, also a clinical social worker in cognitive neurology. We developed this program as an introduction to practical things to consider after a new diagnosis of mild cognitive impairment or dementia. In addition to working with your medical team to determine best medical treatment options, there are a host of what we think of as practical considerations that are important, and some of these should be tackled sooner rather than later. Please remember that people come to this webinar at different points and with different needs, so not everything covered in this webinar is going to apply to everyone. Please take what you like and leave the rest. We'll begin with a very brief overview of mild cognitive impairment and dementia. Mild cognitive impairment, or MCI as we sometimes refer to it, is the first inkling that something is not quite right. As the name says, it consists of mild symptoms and changes in the brain. Importantly, it is an acquired condition and a decline from the normal baseline. The symptoms are not fleeting. While they may wax and wane, they are persistent, and it's often short-term memory or possibly changes in word finding that show up first. We work with many people with MCI who are still working at their profession, winding down a law practice, for instance, or a medical practice, or developing a succession plan. Dementia comes after MCI. Not all MCI becomes dementia, but those with dementia always start with MCI. Dementia is diagnosed when the symptoms have progressed. At the stage of mild dementia, it is rare for people to be working outside the home. In short, dementia is a more severe version of mild cognitive impairment, and there are stages of dementia: mild, moderate, and severe. People often ask if Alzheimer's disease is the same as dementia. Dementia is actually a syndrome rather than a diagnosis, and it's an umbrella term. It describes the syndrome and not the etiologic or the way that the disease came to be. There are a variety of causes for dementia. As you can see on this slide, the most common is Alzheimer's disease, and it's responsible for give or take about 70% of cases of dementia. But dementia with Lewy bodies, vascular dementia, and frontotemporal dementia are other etiologies. And many people do have more than one cause for the dementia syndrome. For instance, perhaps someone is affected by both Alzheimer's disease and vascular dementia. Time of diagnosis, many individuals and care partners want to know what they can do to stop or slow progression. Your medical care providers will work with you about possible medical treatment options. And we also know that lifestyle adjustments can have a major effect on slowing progression. There are 6 categories of lifestyle choices that we think about. Socialization is important. Time spent interacting with other people. Regular exercise is important, not necessarily running marathons, but walking around, getting out, moving the body. Diet is important. We recommend the MIND diet or a Mediterranean diet. Anything that's good for our heart is good for our brains. Structure is important, having a regular routine to the day. And this is especially important because habits can be formed in the stage of mild cognitive impairment, and they will stick with us over time. Sleep is very important. Understanding if you have sleep apnea, having a regular sleep schedule, our brain heals itself in that. And alcohol is also important. Alcohol is not good for the brain. And we do find that when folks have mild cognitive impairment, it often exacerbates or potentiates the effects of alcohol. So it takes less alcohol to have a major effect. Another question that we often receive is, should we tell people? And who, if so, who, how, and what should I tell? The most important answer here is that it's your decision what you share. And it's important to talk, if you have a primary care partner, it's important to talk with them and decide together so that you're both on the same page. Many people do find that it's easier to talk about a symptom rather than a disease name. So people might say, I'm having some memory issues, or sometimes I can't find the right word. It allows people to know specifically what's going on. It is difficult for folks to help if they don't know what's going on. And in general, close family members, especially adult children, will want to know. People also ask, what do I tell my young children or my grandchildren? And they can really be sensitive to secrets and often imagine something that's far worse than the truth. So keep it simple. You might say something like, Nana has some changes in her thinking now. Don't worry if she repeats herself. We believe that the role of the care partner is vital. We see care partners as a crucial part of the treatment team. Indeed, care partners are the most important member of the treatment team. This means for many the need for education, because as far as I know, there's no class in high school that teaches, here's what you do when your spouse is diagnosed with mild cognitive impairment or dementia. One option for care partners across Georgia, particularly those whose loved ones are in the stage of mild or moderate dementia, is a program offered online called the Savvy Caregiver. This is a 12-hour skill building program offered in a group setting on Zoom. For more information, you can reach out to the QR code or the link here on this page. bit.ly/GMN Savvy Caregiver. In addition to education, support is really important. There are a number of support groups that you can join and really can be helpful. One-on-one counseling can be extremely useful, especially with a psychotherapist who is familiar with the issues that come with providing care and really caring about somebody with mild cognitive impairment or dementia. And then self-care and respite time are also crucial for care partners. The other thing we wanted to make sure to cover today is safety. In terms of medication, it's really important to develop a solid plan for managing medication. Pill keepers and reminders are very useful. So often mild cognitive impairment includes a component of memory loss or forgetfulness, and people will forget to take their medications, or they may forget that they have taken their medications and accidentally take them twice. As the disease progresses, having someone else manage all aspects of the patient's medication becomes increasingly important. And that includes getting refills, organizing the pills in a pill keeper, and making sure that they are taken as prescribed. Driving is another huge issue that can come up in the setting of MCI and particularly dementia. Retiring from driving is often one of the most difficult parts of MCI dementia. And there will come a time when you are no longer able to drive. It is helpful if you decide early how you want to handle this. You may want to designate someone to tell you when they think that driving has become unsafe. There are also driving evaluations given by occupational therapists that can be helpful. And it's important to recognize that in Georgia, as in many states, driving with dementia can cause financial ruin to not only the patient, but also the family. And of course, it is a safety issue. We also think about wandering and our concerns about people who may not recognize where they are and want to go, quote, home, unquote, and they may leave the front door. And very often when they leave their phone behind. Safe return bracelets are available online, and the Alzheimer's Association can also direct you to where you can purchase these. They're very inexpensive and provide an emergency number to call. GPS can be very helpful in the driving setting. Smartphone apps such as Life 360 or Tags can be useful. Smartphone apps, though, keep in mind, only work if the person has their phone with them. And as I said, they may leave it behind. And at later stages of dementia, additional latches on doors placed either above or below eye level can help. It's important also to think about kitchen safety and remove or secure alcohol and alcoholic beverages. One of the things that can happen with even mild dementia and certainly more moderate dementia is that folks can forget how many drinks they've had. If a patient must be left alone, consider removing the stove knobs or unplugging if it's an electric stove, or turning off the gas if it's a gas stove when the stove isn't in use. And make sure that all cleaning materials are out of sight and secured if somebody with dementia is in the home. Remove throw rugs to avoid falls and other tripping hazards. And this is better done earlier than later, even if we're not concerned that our loved one may be at risk to trip today. Moving furniture around when somebody is further along in the process of dementia can be very confusing to them. It can also be very helpful to install grab bars in the bathroom. And just a few other safety concerns. It's very important that all guns and other weapons be removed from the home completely. If for some reason this is not possible, they should be stored unloaded in a gun safe, and ammunition should be stored elsewhere. It's important to look out for scams and to have that financial oversight. Cognitive impairment, even mild cognitive impairment, does tend to make one more susceptible to financial and other scams. And for some, this does happen very early in the trajectory of illness. Finally, just a few other tips. Make sure that smoke and fire detectors are working, carbon monoxide detectors, night lights, especially in the bathroom, that help people get oriented in the middle of the night can be extremely helpful. If somebody is no longer able to drive a car, they should not be driving a tractor or a lawnmower either. And if the person with dementia does have a lock on the bedroom door, be sure that you do have a means to unlock it from the outside. Individuals with dementia can forget how to unlock doors. And with that, I'm going to turn it over to my colleague, Alice.
Thank you, Ashley. Next, we want to focus on legal documents. And these are documents we think everyone should have on this journey. The first one is the Advanced Directive for Healthcare. And what that is that is a form that allows you to share what your wishes are regarding your healthcare. And you get to appoint an agent, someone who is going to be able to make decisions should you not be able to voice your wishes later. We encourage people to complete an advance directive as soon as possible. Actually, everyone should have an advance directive, whether you have cognitive impairment or not. But again, this is something we want you to complete as soon as possible. Also, the financial power of attorney. And this is where you appoint someone to manage your financial matters if you're not able to do so. There is more than one type of financial power of attorney, and so we do encourage people to speak with an attorney, an elder law attorney, about those documents, but I will be talking about elder law attorneys in the next slide. The other thing is a Social Security representative payee. And this is where you appoint someone to manage your Social Security benefits. Now, this may not be a form, but we do encourage you to contact Social Security so they can let you know whether you need to complete a form or not. Think about it as you want someone to do this because if something happens with your bank account, and you're not able to talk with Social Security and you need your loved one to do so, this is where Social Security needs to know they will not talk with someone unless they have permission from you. So that's why you want to go ahead and give people permission ahead of time. The last thing is a will, and most people know about this. This is for directions for after death. So the advance directive for healthcare, the financial power of attorney, and the Social Security representative payee all occur before death. Next slide. So next talking about legal assistance. And so this is where I was talking about the elder law attorney. And these are attorneys who specialize in legal issues of older adults, including protecting assets in preparation for the possibility of long-term care. Costs may vary when it comes to obtaining an elder care attorney, but we really encourage people to meet with someone because they will know what to do. They know how to protect. And we don't know sometimes when our loved one or when ourselves, when we may have to go into long-term care, and we want to be able to protect our monies and protect our loved ones, those who may, if we have spouses, those who will remain in the community. There's also the Georgia's Elderly Legal Assistance Program, and these are attorneys and paralegals who provide legal assistance to individuals 60 years of age and older in every county in the state. There's no cost for information, education, or representation, but there are eligibility requirements. There's a number, if you call the Georgia Senior Legal Hotline, you'll be able to speak with one of the representatives. Next, we want to talk about disability and family medical leave. And this is when people are normally working, usually still in that MCI phase, maybe still early dementia. What we want to talk about is the Social Security disability insurance. And the eligibility is that you must be unable to work due to the illness. And you must have worked and paid into Social Security for an equivalent of 5 of the last 10 years. So if you haven't worked for 12 years, then you would not be eligible with regard to Social Security disability. Also, you must not be receiving Social Security retirement, because if you're already retired, then that means you would not be disabled from working. And so this is something Social Security you can apply online. But we want to start talking about Social Security when someone becomes diagnosed, because this is something we want to be able to protect your income. And it does take some time for Social Security disability to to become active if you're eligible. There's also employer-related disability. And this is a benefit that's offered by some employers. It may include short-term and or long-term disability. Most of the time you are paying into this. Some long-term is offered by employers, but this is something you would need to speak with your HR department to see if you have been paying in or if your employer does offer these benefits. The Americans with Disabilities Act. Now, this is something that requires employers to provide reasonable accommodations to qualified applicants or employees. So sometimes when we're early on in the diagnosis, like an MCI, you're still able to do your work, but you may need some assistance. It could be some extra time. It may be help in terms of what you're looking at, having someone help you to look over something. So reasonable accommodation, that's a change that allows employees with disabilities to do essential job functions without causing the employer undue hardship, meaning that it can't be too much difficulty or expense. And so we encourage, if people are still able to work, but they just need some assistance, some accommodation, this would be something that you would speak with your physician on what reasonable accommodation could help you stay in your position. The other thing is family medical leave, and this is a federal benefit that allows up to 12 weeks of unpaid job-protected time for individuals who are ill or a close family member providing care. So this is something, of course, you would have had to be on your job for over a year with regard to being eligible for this benefit. This is something we really want to talk to the care partners about, because sometimes your loved one may be needing to go to doctor's appointments, or they may be having challenges going on at home, maybe having some type of episode where they're needing your support. So as a care partner, it's just recognizing so that you can protect your job. This is something that you would want to talk with your employer about and apply for family medical leave. It can be intermittent and not consecutive. So sometimes people are thinking that they need to take the 12 weeks, and that's not true. You don't have to take all of it at once. It can be where maybe you have a reduced schedule, or maybe once a week, there's a day that you have to take off for your loved one. So next we want to talk about financial resources. And what you will see on the screen when I'm talking is you'll see things like Medicare and Medicaid, and we're thinking that's not finances, that's health insurance. However, it is the health insurance that helps to pay for certain things. So Medicare pays for 80% of doctor's visits and necessary hospital stays. Medicare pays for home health care. And that's general tasks that require a registered nurse, a physical therapist, occupational therapist, a social worker. Medicare does not cover companion care, assisted living, personal care homes, or custodial care at a skilled nursing facility. A lot of times people will ask us, well, why won't Medicare cover these things? Why can't they cover where I'm going to live? And that's because an assisted living is a residence. It is not a medical community. And so Medicare does not cover that because Medicare is health insurance. Then we have Medicaid, and Medicaid is something that you must apply for. We have some old figures on there right now in terms of for 2023, but you could see what the income cap was. Back then it was $2,742 a month, and a savings cap of $2,000 for individuals. And married couples have a different criteria. So each year they will put out the new income cap for Medicaid. Medicaid does have waiver programs, and that's why we encourage people who qualify to go ahead and apply. What they have is like the Elderly, Disabled, and Waiver Program, which is formerly CCSP, and they have SOURCE. And I'll be speaking on these later, but these are things that help to cover in-home care and things in terms of support and adult day programs. Medicaid will also cover skilled nursing facility, and that's in terms of that custodial care. And we'll talk about skilled nursing facilities a little bit later. There's also long-term care insurance, but this is something that must have been purchased earlier in life. And every policy is different. You need to read your policy to learn about activation and benefits. They are different, and they may have different requirements in terms of whether you're able to perform activities of daily living or whether you need supervision because it's unsafe for you to be by yourself. So that is something in terms of looking at your long-term care insurance policy. There's also the U.S. Department of Veterans Affairs. Veterans may be eligible for veterans pension benefits. And so for more information on that, you would go to the Veteran Administration's government website. One of those things that we would encourage you to look at is the Aid and Attendance Program. That is something that helps to provide in-home care. And so again, if you are a veteran, please check out to see if you qualify for a benefit. So now we want to start going into talking about future planning and living arrangements. And these are things that when we talk about people enjoying life and the quality of life that they have as they're on this journey, one of the things we talk about is adult day programs. And when Ashley talked about those lifestyle things in terms of what helps us, what benefits us, that's socialization. And that's what adult day programs help with. They are structured and supervised programs that provide opportunities for individuals with dementia to socialize with others. Now, the culture of adult day programs and the admission requirements vary. Some of them some of them allow a try it out day to go and see. And the cost is not covered by Medicare or private insurance, but an adult day program may be covered by that elderly disabled waiver program, that Medicaid waiver program that I mentioned, or a long-term care policy. Again, adult day programs are helpful when it comes to socialization, also when it comes to respite for the care partner. Sometimes people may say, well, I don't think I want to socialize with that, or I've never been a group person. We always encourage people just to try it and see. And you may find that this is something that you want to engage in a couple of days a week. Next is home care. Individuals who provide companionship and can provide assistance with meal preparations, light housekeeping, transportation, all these activities of daily living, bathing, dressing, medication assistance. That's home care that we're talking about. And this can be hired through a home care agency, or you can hire someone directly. Of course, if you hire someone directly, we encourage you to definitely vet them. But there are agencies that will vet and provide and that are licensed and bonded. This is different. Home care is different from home health care, which again, as I explained, that includes medically necessary skilled services, that registered nurse, that PT and OT. Home care is not covered by Medicare or private insurance. It may be covered by the Elderly Disabled Waiver Program or a long-term care policy because this home care does not require someone to have a license. This is something that's in terms of having those activities of daily living taken care of, that companionship. And so it's not health, even though we want to consider that, we know it's kind of health overall, the overall person, but it does not require you to have a license to help take care of someone. So that's why it is not covered by Medicare or private insurance, health insurance. Assisted living facilities and personal care homes are residences where a person has their own room and have access to provided meals and other activities, and programs and costs also vary tremendously. This is where people also have the ability to socialize. This is where people have the ability to be taken care of, to have their activities of daily living assisted with. Individuals, though, who require 24-hour nursing care are not eligible. People need to be able to transfer themselves from a chair to a bed. This is not a medical facility, it is a residence. And so the cost is not covered by Medicare or private insurance. But if you have long-term care policy, it may be covered by that. The Elderly Disabled Waiver Program may assist with the cost of personal care homes only. And so again, it's good to check out to see if you're eligible for that Elderly Disabled Waiver Program, the benefits that it provides. But again, assisted living facilities and personal care homes, sometimes it helps to alleviate the stress of having to manage and navigate a house, a large house, a small house, yards, things of that nature. And so it's thinking of here's where you are able to continue to engage in life, have people around you, and have the support that you need. Skilled nursing facilities. Now, there's two levels of care with a skilled nursing facility. There's a subacute rehab, which is a temporary stay, and then there's the custodial care with the skilled nursing facility. To be eligible, patients must require a 24-hour nursing care. So someone can't just say, okay, I want to go into a nursing home. It does require an order from a doctor and a doctor to say that somebody does qualify. Subacute rehab care is generally covered by Medicare. The custodial care would be covered by Medicaid, and that's nursing home Medicaid if individuals qualify. So sometimes I'll have people who will be in the community and they say, well, I don't qualify for Medicaid right now, so I can't go into a nursing home. That wouldn't be an option. The nursing home Medicaid is different. And that's why we also encourage people to talk with elder law attorneys because they're able to talk through that financial piece of how you may be able to qualify for Medicaid later on if it's needed with a skilled nursing facility. We wanted to include geriatric care managers because geriatric care managers are specially trained professionals that can help find resources to make your daily life easier. And so, what is it that a geriatric care manager can do? They can make home visits. They will evaluate your in-home care needs. They can help take the pressure off of selecting care personnel, people coming in and out of the home. They can coordinate the medical services, going to inform doctor's appointments. They can evaluate other living arrangements. It's kind of like having this person who is there, this other child, someone said an adult child or adult friend who is just really there to help take care of you and manage your life to make it easier. People use them, especially if you have a loved one who lives far away and you're not able to be with them, to manage them every day. A geriatric care manager may be able to step in and provide that space to fill in the gap. The cost, it varies per care manager. It is private pay. Most insurances do not cover. And we have to say that it can be very expensive to use a geriatric care manager, but it can be so worth it in terms of the time and the effort that's needed for managing somebody's care. You can find you can find a geriatric care manager by contacting the elder care locator. You see the link is there on the slide, and the Aging Life Care Association also has a list of care managers. Some resources we also wanted to provide are one is advocacy groups. So as we talk about the different dementias, what's causing the dementia, the Alzheimer's disease and related dementia websites and the Lewy body and frontotemporal dementia and Parkinson's dementia, all of these diseases, conditions have agencies or organizations, I should say, who provide education, who provide support, and it could be in the form of support groups, or it could be in the form of information and referrals to where you can call them. Many of them have call centers to speak with someone where they're able to provide you with the support that you need and resources out in the community. And also whatever else is going on, what interesting studies may be going on. These groups would have them and to let you know what the research is. Financial assistance, there's the Georgia Aging and Disability Resource Connection. That's a database of resources that are available to you that are through it comes through the Area Agency on Aging, and that is in all counties of Georgia. And so we encourage you to check that out in terms of financial assistance. Again, I talked about the Georgia Medicaid Waiver Program, Social Security Disability, and United Way. And United Way has assistance not just with regard to what's going on with your condition, but when we're talking about assistance with rent, assistance with utilities, those things that are also possibly needed at this time. And then there's a couple of books that we want to let you know about. The 36-Hour Day is a resource guide. It is overwhelming to read cover to cover. So it's something where your loved one, or you may be experiencing something at the moment, some type of symptom. You can go and look and see, okay, how are they talking about it? What is going on with this? What support can I get with it? What can I learn? What's the education? Loving Someone Who Has Dementia is also another book that you can read with regard to getting support and figuring out just how to handle this journey that you're on with your loved one. So, of course, that is definitely not an exhaustive resource list, but these are just some things to get started. And so we really hope that this webinar has been helpful to you with regard to the different things of how to start, what to do next in terms of diagnosis. We appreciate you joining us, and we hope that you have a great day.